Good morning, Torbay. Well, we were out on the road. Now I'm firmly locked up in my kitchen because if you can work from home, please do so. So that's what we're going to do today. Last month or 2 weeks ago, we were at the Epic, and today we are definitely here in my kitchen. And in his playroom, we have Jim Parker. Morning, Jim.
Morning, how are you? Okay.
Yeah, Ali, I'm not sure if that is the east wing or the west wing you're in there.
It's actually at Roadcroft. I couldn't trust the kids to be quiet.
So Ali from Roadcroft. And in her study, right at the top of the tower, we have Caroline Diamond, Director of Public Health for Torbay Government. So thank you so much for coming to join us, Caroline, today. Can you hear us loudly?
Yeah, morning everyone. Nice to be
Good
here.
morning. Good morning. So quickly, Torbay Business Forum. This is episode 12 after 6 months since that amazing eventful day in March when we were all told to go home, stay home. So here we are. Just when we thought we were emerging from the shadows and getting back into business, we've had to put the brakes on. And we're going to find out a little bit more about that in a moment. But also today, we're going to be looking at the business support cases that are around the funding for business, the tax implications, and also the HR implications of what is going on with the end of the job retention scheme and all the new flexible services and umpteen versions of Kickstart. So whatever that means. We'll be looking at the charitable sector with Ali from Roadcroft, seeing how difficult it is for the charitable sector to raise funds at the moment. So we're talking to Ali. And we will be talking then, when Tony joins us, Tony Medawar, about the Agatha Christie Festival, the International Agatha Christie Festival that is happening in 2021. But before we start that, I want to thank our sponsors, sponsors of the month, Torbay Weekly and Susan's Florist. So thank you so much for sponsoring the forum. Without your sponsorship, we could not produce our events. We could not be here to help you and to keep bringing businesses together. So in those famous words of next slide, please, Emily. Torbay Business Forum exists to bring businesses together. And Jim and I know we are on various boards, various groups around the Bay, whether that's Torbay Together, the local outbreak engagement board with Caroline. We are here taking your views forward and representing business. Because we want to look at business, its growth, the infrastructure and our skills. And skills is definitely coming to the fore at the moment, which is why we have such great ties with South Devon College. So Jim and I have been in a bit of trouble. The next slide, please, Em. Yeah. You had us locked up. And at the moment, by my reckoning, haven't quite raised enough money yet. So if you could have a look and take pity on us on our Just Giving pages. I also did a post on Facebook, which you can nice and easy donate now. I think I'm just over the 750, which Barclays Bank is going to double for me. But Jim, he really needs help. So please, the lines are still open, as they say. I think, just to give you a little bit more of a flavour, could you run VTM? Hopefully. It might work.
Bear with me.
Do a dance. It might. Here we go. Oh no, not that one. We're muted. We're unmuted. Excellent production there. So thank you. Ali, go on, give us 2 minutes. What's all that about?
Well, every year we hold our jail or bail event for Rowcroft. This year we had 11 people, convicts, signed up for it. You will probably recognise some of their faces. Usually we hold it in April, and that's what we plan to do this year. And I would like to say the photo at the end of that was taken before lockdown, before the social distancing restrictions. Obviously, we had to postpone it this year, and then in the end we did it all virtually. So, and I think that's one of the amazing things about our fundraising team, is that we can work really flexibly. So we had 11 convicts. That some of them are still locked up, like you two, because you haven't raised enough money. And some people have raised loads of money. So most people are meant to be raising £1,000 to get out of jail, and we really hope they do that, because if we can raise £11,000 for Rowcroft, it's going to make a real difference. We're probably going to put on the event next year, hopefully for real, so people will actually be locked up. So if anybody's interested, it will probably be next April. Obviously, everything's a little bit up in the air. So, but in the meantime, please do sponsor. Steve and Jim and Andrew Price, one of your sponsors, also took part. So if you go onto the Rowcroft website and look up jail or bail, you've got all the sponsor pages of all of the convicts there. So please do sponsor them.
Brilliant. Well, thanks, Ali, and I really do appreciate the efforts that you're putting in, because Jim and I have had a bit of a giggle over it, but it would have been more fun if we could have been together. So,
About that.
He doesn't
well,
think
for some of us. But I think that we've got 40 people on the call now, and what I'm going to do now is to come across to Torbay weekly and say, Jim, what's news around the Bay?
Hi, Steve. Yeah, thanks very much. Well, the weekly again, obviously you're aware the weekly is full of content sent in by our list of columnists at the heart of the community. So we've got that vast array again this week. We've got a new one. We'll be well known to forum members, Sally Allen from Sally Allen Fashion. She's now a regular fortnightly columnist with the weekly. Some really controversial views, and she's loving it. And we've got the established columnists like the former Torbay GP Peter Moore. Caroline might remember Peter Moore from days gone by. He's one of our most popular columnists. And we have a bloke called Roger Mann, who used to work for Frank H. Mann years ago, that will be known to some people. So Roger's our retro sport man. He goes back to the 1740s when sport was played with leather balls. And one of his columns was about a goalkeeper playing for Ipplepen who got shot not once but 3 times during a game, was carted off to hospital, and they continued with the game. So it's a great read, Roger Mann, really is a good read. And we've got this week a column with Sedham College. The college are sponsoring our business pages, so that's their turn for a column this week. So you can see that vast array of people that write for us, which is really good. And talking of business, we've got details of another help scheme for the tourism sector, which is being launched, which the TDA are playing a part in. Peter Vosper, well known in the car trade, is now a regular columnist for us on our motoring pages. Our property section is growing by the week. We now have Benisworths who have joined the clan of agents, and one of their properties last week was Badger's Holt, Steve, on Dartmoor.
Yes.
So if you've got 1.4 million quid, which I'm sure you have, you can go and buy Badger's Holt. We'll go house. How about that?
Yeah. Escape to the country.
Yeah, and then for sport, obviously talking like I played the first game last week behind closed doors. We've launched a special predictor competition where you can predict scores and win £1,000 at the end of the season. And then last but not least, Christmas has come early for the weekly and our Torbay readers. We've done a deal with the Malden Christmas tree farm at Malden, and if you get the paper, it's a £5 off voucher in the paper. And I'm told they were flooded with weekly readers when it was open for the first time last Saturday. So happy Christmas.
Well, happy Christmas. We're really supposed to use the C word just yet, but I think I do prefer that C word to the current one that is definitely flavour of the year. And it's just amazing to see the stats just mounting. And this is where I'm going to ask Caroline to come in. Caroline is our Director of Public Health for Torbay Council. And if anybody's in a hot seat at the moment, Caroline, it must be you. So I'll hand over to you. I think you've got a few slides for us, and you can tell us a little bit about who you are and what you do and what you've got.
Yeah, thank you, Steve. before we go through the slides, I thought it might be quite interesting for people to understand, what I do, and also what the role is of public health within the council, as opposed to sort of the myriad of other organisations you'll hear about. So I'm actually a doctor. I trained to be a GP, but then I kind of swapped to public health when I realised that there were an awful lot of people that I couldn't help. The mother who had asthma because she lived in a damp house, or the child that kept going in and out of hospital, again because of where they lived or because of poverty, or the mother that kept getting kind of joint pains because she was overweight. And I thought, actually, to make a real difference to health, I need to work differently, and that's when public health came in, and the rest is history. So it's very much, instead of having a patient as a client, if you like, you have a population, and you think about what's wrong with that population and how you can help. And this is very much working with a whole load of other people, different I work with the NHS, I work with the community and voluntary sector, whoever I need to work with in order to support the population's well-being. Now, Torbay Council is very small, one of the smallest in the country, and my public health team is probably the smallest in the southwest. So there's only a team of 12, and normally what we're doing is we commission things like health visitors, school nurses, sexual reproductive health, drug and alcohol services, and a whole myriad of other things. And in terms of diseases, actually, before COVID, it was probably only 2 days worth of our work. And that also covered things like screening, vaccinations, and any communicable disease you could think of. So it's been a huge step up for us to move into the COVID space from that really, really tiny beginning, probably sort of 600% workload increase, to be honest. So that's us, and that's the local authority. But you'll also hear about Public Health England, and you'll also know about Chris Whitty. So just to explain how they fit in. So Chris Whitty, Chief Medical Officer for England, very, very intelligent man. I have weekly webinars with him. So he's the scientist, and he works with the government to decide on policy going forward. And the main health protection agency, the main agency whose job is to oversee communicable diseases, is Public Health England, and that's different from us. So Public Health England is a national body, it's a civil service. And during COVID, they've been supported by a big private sector organisation called Track and Trace. So you'll hear about Track and Trace, you'll hear about testing, and you'll hear about Public Health England. They are all national bodies. So our role is to support them in their work, but not to do it. And I think that's sometimes a bit confusing. So just to put what we do in context. So some of the testing issues that we've had recently are a national issue, and the Track and Trace, any issues with Track and Trace is also a national issue. But of course, then my role is to do what I can with my team to support the battle, I suppose, against COVID. So we have sort of 4 main roles. And one of the most important is to help people, businesses, schools, care homes, housing companies, prepare and make sure that their premises or their working practices are COVID safe. So we work very much with also environmental health officers, because they know the bay. So for instance, we've run, I think, a webinar with this forum before, which has been about trying to support people to do the right thing, to prepare for COVID, to make sure their practices are COVID secure, and also to know what to do if you've got a case. So we work with absolutely everybody to try and do that, because still, for me, prevention is better than cure. If we can prevent the uptick in cases, that would be better. So that's one important role. Another important role is the work that we're trying to do. I mean, I think Steve mentioned the Outbreak Engagement Board, which both Jim and Steve sit on. And for instance, we've got a meeting this Thursday, and Kelly from the college is going to come, because she's been doing some work with her young people around behaviour change and how we can support our young people to act in a socially responsible manner. Because if we can change people's behaviour, we can stop the virus spreading. So that's a really important role. It's just us supporting and working with others. More recently, and actually throughout the first peak, we're also concerned about people's welfare. So, for instance, the hospice, we were linking up with the hospice around bereavement services, about mental health services. They were supporting us with a mental health helpline, for example. So, and we're working with the community and voluntary sector and the Torbay helpline, linked in with them, very much feeding information to them and supporting them. So that's about welfare. And now it's coming online, how can we support people to self-isolate? So that's the third important role that we have. The fourth one, which could be absolutely enormous, so we have to, and take away from all those other areas, is to support the national systems with their contact tracing. So, for instance, we've had a few outbreaks over the last week, and although our role isn't to case find and contact trace, because we've got the local knowledge and because it's really important for us to support that process, we've been going in, helping to ring a few cases, giving some advice, etc. So it's a supplementary role based on our knowledge of the local area, and basically we do what we can to support that. I suppose I put a webinar out a little message out this week, which I think went out on social media, because actually over the last couple of weeks we have had this uptick in cases, and the message was, and I'll show the slides in a minute, the message was that this is now becoming serious. So we do now need to, although we've still got a relatively small number of cases in the Bay, they are going up. So we need to be increasingly vigilant. So I'll just run through those numbers, and then, if I may, a couple of key messages from me to everybody, and then I'll open up for questions. So, Emily, if you can just go to the first slide. Right, thank you. Now, as you see, this is the number of cases, numbers up the side, and along the bottom dates. You can see over August we had a couple of humps, but actually we were running at about sort of 12 cases a week, not very many at all compared with what was going on up in the north. Right over, I mean, in July the cases were very, very tiny, less than 5, but then about 12 cases a week over August. And then from the middle of September onwards, you'll see the cases started to rise. That is partly because cases were just becoming more prevalent in the north, and it was bound to sort of go countrywide. Some of it was a difficulty with the testing issues, the national testing issue, but definitely those cases are now beginning to rise, as you see. Next slide, please. This is quite interesting because when we had the first peak, the vast majority of cases that we knew about, and don't forget that we weren't testing people that time, we were tended to test people who were either in hospital or care homes. So we saw the cases more in the elderly population. But now we're testing many, many more people. You'll see that the vast majority of people getting this virus, as far as we know, are the 20 to 40-year-olds. So actually that's about young people in particular, young adults in particular. Maybe they're more out and about a bit more. Maybe they're not doing everything they should do in terms of preventing transmission. So we're seeing, we're very much seeing the number of cases in that age group grow. And you'll know this by listening to the national news. And gradually we're seeing now, even since that slide was doing, a slightly increased number in the elderly population and in the younger population. So, and some of it's related to schools went back. We saw a rise within children, and that now the universities and colleges are going back. We're seeing a rise in young people, and that's a sort of national picture. So it's different from the first wave, but you've got to remember we weren't testing at that time. Next slide, please. So this is how we compare to England and the Southwest. Now, there's still the concentration of cases in the Northeast, the Midlands and Wales, but we're kind of a little bit behind, probably 3 or 4 weeks behind some of those areas. And our prevalence is still a lot lower. I mean, we talk about the number of cases per 100,000. In some areas, it's now greater than 300 per 100,000. And we're still running sort of really low at sort of less than 50, more like up until last week it was only about 11 per 100,000, so a lot lower than other areas. The southwest, very similar to the southwest. Just in the last week, we've seen some clusters. So we're just above that shows we might be just above the southwest, but it's to do with the way that the virus is emerging, rather than that being necessarily a general community spread. But I think the key message is we're still a lot lower than a lot of other areas in the country. Next slide, please. Hospitalizations, these are still pretty low. We've seen very few cases, sort of only 1 or 2 in our hospital locally, but they are just gradually creeping up now as well. Next slide. Thank you. And actually, sadly, yesterday we had our first COVID-related death, but that was in a very, very elderly lady who was actually on palliative care anyway. So it's always difficult to know whether, in those circumstances, whether somebody died with COVID or of COVID. But apart from that, we've not seen anybody who's been really ill or anybody who's died. So, and I think that reflects the fact that most of the infection is still in that younger age group. Okay, I think that's it for slides, isn't it, Emily? Yeah, that's great. Yeah, so that's the picture that we're seeing. So it's mainly in young people, but just in this last week, we have seen cases coming up through in care homes, but it's mainly staff. And the reason for that is that we're now testing staff every week. So if you start testing people, you will find the virus. So it's got to be seen within that context. But for me, that says that actually COVID is in Torbay now. Small numbers, but you know, if we don't work together to try and stop the transmission, then we will see even greater cases. And of course, that what we absolutely don't want to do is to see any lockdown happening here in Torbay. So that's what we've got to prevent. So it is still the same old messages. You know, cover your, wash your hands. And it's always better to wash your hands and use hand sanitizer, wear a mask, and create the space around you. It's still the same, that's still the same message. But I think in particular for business leaders, it's important that you support people to self-isolate. We've already had a couple of areas where there's been transmission within businesses. It's, you know, you've got to get onto this thing really quickly. Often, because we've had the testing issues, there's been a delay between somebody becoming symptomatic and they're getting their test results. So people really should be self-isolating if they've got the COVID symptoms, rather than waiting for the positive test, because if we don't do that, it'll spread within our businesses and then it'll be out in the community before we know it. So, and I suppose that's about also the policies and HR policies that you have to make sure that people feel able to self-isolate, because if people don't feel supported to self-isolate, they won't do that. They'll come into work with symptoms, and we're seeing that as well. And again, the virus will spread. So I think it's even different than 2 weeks ago, now that the cases are going up. I think the other thing that I struggle with is, where do we put our emphasis? And this is a discussion that I'm sure happens over coffees and things. You know, should we focus on health or the economy? Should we focus on the young or the old? Should we focus on people's emotional health or people's physical health? We have to try and focus on all of those things, but they're all connected. If we don't support the work that we're doing to try and decrease the transmission of the viruses, we will end up with further economic harm. So the two are intertwined. If we don't support people's emotional health, they will become physically unwell, and also they won't be able to contribute to the economy. And all of those things are a really, really difficult balance. And our politicians are having to make that balance. They're having to balance the scientific evidence with the evidence about harm to the economy, and I think that's always a really, really difficult call. So the key message is, for me, is the hands, face, space is still important, but probably equally important, people must self-isolate if they've got symptoms if we're to prevent the spread. And I think we're seeing that often not happening, and that's probably leading to the increase in cases that we're seeing locally. So any support you can bring to that would be very gratefully received. Okay, so that's all I wanted to say, and happy to take any questions.
Wow, that's an amazing roundup, and it's not a question so much as a comment coming on the questions line. Just a reminder, anybody can ask a question using the question panel. Pete Blackler from Insignia Creative noting what an important job Director of Public Health is. And Caroline, we're very, very pleased that you're able to join us today. And I do know you're very busy. There's a few things kicking off, I'm sure, that you need to be dealing with. But if anybody watched the Salisbury poisonings programme, I bet you weren't glad. I bet you're glad you weren't based in Salisbury at the time, Caroline. So.
Yeah, I mean, the programme did show that the Director of Public Health, as though they were the only one. They clearly weren't, because we work really closely with Public Health England and other people as well. We're not on our own. But I suppose I'm the only person on my team who feels a particular responsibility towards Torbay. So I will always be thinking, how can I support Torbay and Torbay residents as well? So yeah.
And thank you for the work that you do. One of the things that came to mind, we're talking about the 20 to 40-year-olds, which Jim and I can just about remember. But the universities, is this not some other version of chickenpox parties?
No, I mean, you're seeing that. Don't forget, you're seeing the cases. I mean, you're probably talking about Exeter, because they started testing in Exeter. They've been using a saliva test. And these are people coming from all over the country together and staying. It's mainly in the second and third years, staying in small households where where they'll be quite where they know each other and be living quite closely together. It does make you wonder that if you started testing a whole lot of people, how much of it you'd find, but they're going out to test people. And they might have a slightly lower threshold to that testing than in some other areas. So it's not indicative of what's going on in the rest of the city. In fact, there doesn't appear to be much spread at all, as far as I understand it, into the rest of the city. It's very confined to the university. But the university have been really proactive in terms of what they're doing. Everything's very COVID secure, the way that the lectures are set out and the way that people come in and off campus, and the young people themselves have pledged to conform, etc. So I think they're doing everything they can. But you're seeing the numbers because they're testing, basically.
And can I ask you, do you have any thoughts on the way the Swedish approach this, where they let it happen, and they're saying that it's gone from Sweden now? Do you believe any of that?
I think we've got to remember that a lot of what we were doing, particularly in the first wave, was to protect the vulnerable and protect the NHS. I mean, as a doctor myself, it would have been awful for all of us, I think, if we'd seen the hospitals being overwhelmed by this, and our loved ones not being able to get intensive care and people dying unnecessarily. And I think that's in particular what we were trying to do, particularly in the first wave. I mean, this time we know a little bit more about the virus. People understand their vulnerabilities. They're able to shield very much with the support of the CDT helpline, and also what the council has been doing. A lot of work through the council, setting up shielding hubs and giving people access to sort of financial support, etc. So this time, at the moment, it's more in the younger population who won't have health problems, hence the lack of admissions, etc. So we know how to support people better. But yeah, I think certainly we don't want to see that again. We don't want to see our hospitals being overwhelmed. And the other thing is, if the hospitals are just doing COVID, they're not seeing other people. And I was as worried about what we call COVID-related ill health. So people who couldn't get their diabetes check, or couldn't get their blood pressure check, or importantly, couldn't see people if they were feeling, you know, emotionally unstable or emotionally worried. That all had to be set to one side. And in the longer term, I think it's going to be economic injury and mental health and trauma that we'll be living with post-COVID for many, many decades. Not the illness itself would almost be long forgotten. So we've got to remember, and again, we've been trying to step into that space, you know, trying to create a mental health alliance, etc., to deal with those longer term impacts. And the economy will be absolutely top of that list of things that we will need to deal with in the longer term.
Yeah. Okay, so thank you. But what we're saying is we need to support the self-isolation at the moment, follow the guidelines, follow the rules, do our best. Short-term pain, longer-term gain. Is that what you're saying?
Yeah, I am indeed. Yeah, and it might feel difficult to do that as a business, but if we don't, we are in danger of ending up back in lockdown again.
Yeah, which obviously we do not want.
No.
So I really appreciate. I haven't got any more questions come in on the line. I don't know, Jim, have you got a final question for Caroline?
Just again, I think there's a lot of confusion out there, Caroline. Generally, with some mixed messages coming from on high and down. I think that's one issue. I think, but how do the figures compare now to the first wave? I think that a lot of people are a bit scared, a bit jumpy about where we actually are with the. We hear about the first peak. Then is the second peak coming? So where are we in comparison with the first outbreak?
Well, it's really difficult to say, Jim, because we weren't testing then. So we're testing now. So we're seeing more cases quite quickly. But then last time we weren't doing all that testing. We didn't have the capability, you know, in the country to test. So it's difficult to tell. I don't even remember back in March, we saw some schools and some GP surgeries ending up with outbreaks and ending up needing to close. We've only had one school with 1 year group have had to close, and that might not be for very long. So, you know, and we saw care homes last time, we're seeing care homes this time, but then a lot of that is because we're testing all the staff all the time. So you can't really compare one to the other. Looking forward, modelling is almost an impossible job because there's so many variables. I'm hoping we won't see as many cases as last time, but we're going into winter. We're going into an environment where we're all closer together. And we've also got something called COVID fatigue, which means people are kind of fed up with doing what they should do. And they're more likely, and I'm afraid it is, you know, I've got 2 young sons who've just gone off to university, so I know exactly, you know, what it's like going off to university. You know, they may find it more challenging to behave in a COVID secure way. There's that we've got to deal with, and those factors might lead us to more COVID. But if we do the social distancing, we self-isolate, and the people who know they're vulnerable are careful, then hopefully we won't see such a big peak this time. But it is all dependent on those factors, which is unknown. So hence the messages.
It just reinforces what you're trying to achieve when it comes to that message, and everybody's got a part to play, from business to residents of all ages, and the job you do has been magnificent, and we need to support what we're doing. End of story, simple as that.
Yeah.
Thank you very much.
Really do appreciate you giving up your time today. There is one question just come in from Ronnie Holden, and do you personally think the 10 p.m. close down is correct?
Now I think that was a response to the issue that we were seeing, which was people maybe not conforming to the social distancing, particularly amongst young people. Now you could argue that actually, you know, you can control social distancing in the pub, in the restaurant, but you can't control it outside. But that was what was behind it. So I suppose it depends on people's response to that, because the other thing is the more you drink, and we all know this, the more you drink, the more our young people drink, the less likely they are to follow the rules. So some of it was was thinking, well, if we close early, people would be drinking less, therefore they're more likely to conform. I must say, overall, from what I'm hearing, people are generally, not universally, but generally conforming in Torbay. We'll find out later down the line, but probably on balance, it's not too bad an idea. So it's not just the hours; it's also the level of alcohol people have drunk.
Yeah.
But you know, and I guess it's down to all of us to think. You know, are we going home afterwards? Are we, you know, mingling in the streets, or what's happening? So the jury will be out on that, and it will depend on each establishment, etc. But that was the thinking behind it.
Yeah, well, thank you for that one. Put you on the spot there, but it's obviously an emotive subject for many businesses as well.
Yeah, absolutely. No, I completely understand that. I think it's such a difficult balance,
Yeah, and we will see as time plays out, we'll see whether this huge increase in number of cases actually manifests itself in hospital admissions, whether we'll be needing the Nightingales. Let's all hope that it's not, and that we've done the right thing. Let's get through this, because Christmas is coming and we need Christmas, don't we, folks? So, Caroline, I'm going to let you get on.
Yeah, thank you.
You're welcome to stay, but if you need to go, please, we thank you so much for today, and we look forward to seeing you. And folks, if you have any more questions to come in, you can ask Jim, you can ask me, and we will pass them on to Caroline through the local outbreak engagement board when we have our meetings. So thank you, Caroline, that's fantastic.
Okay. Thank you. All right, bye-bye, everyone. Bye. Bye.
I've got Helena. I can see Helena. James run away. Has he left you to it?
I don't know what's happened to James, but I'm sure he'll be back in a minute.
There he is. Ladies and gentlemen, you are seeing live here at the Business Forum, possibly the two most famous people on Facebook and Zoom, certainly in our area. You've been running your marathon of events, 10:30, Monday, Wednesday, Friday. It was every day, wasn't it, for a while? Tell us how you got into that. Introduce yourselves and tell us about it.
Hello everyone, my name's James Twigger. I'm one of the directors of Accounting for Everything. I went back to the end of March. I think it was Helena's idea in the first place about doing the webinar. We did a one-off at the end of March. We ran out of time, and they said let's do it again Monday. And then we were doing it purely on Zoom. And then I discovered a little button that said stream to Facebook. So click that button, and then it just exploded from there. I'll let Helena introduce herself as well.
Yes, I'm Helena from the HR department. James and I have known each other for a couple of years. And when coronavirus started and lockdown happened, we were really aware that from our clients and other business people we knew, there was just this barrage of information for business owners. And we just thought, my God, how can anyone figure this out if they're not either a finance or an HR specialist? So we thought, let's try and cut through all the government information, pull out the relevant facts for people, and try and explain it in an easy to understand way to save business owners who were already stressed and stretched, to save them having to trawl through loads and loads of government emails and treasury papers. So that's how it started, and here we are nearly 7 months later, still doing the same thing, Monday, Wednesday, Friday, 10:30 to 11, and here today as well.
Excellent. Well, could you, each of you, give us a bit of a flavour of the type of things that you've been covering, and also what's hot at the moment? What's actually live and dangerous?
I'll go first. So yeah, 2 weeks ago we had the winter economic plan. So the Chancellor stood up and gave a bit of an update to where we are with everything. We were expecting to be having a budget next month where we're going to be perhaps hearing about tax changes, whether that's going to be tax increases or tax decreases, but that got cancelled. So in that place we got the winter economic plan. We'd already, oh God, my screen's gone. So there was a few things that was now. So back when we had the first lockdown, we had a number of schemes. We had the small business grants, we had the job retention scheme or furlough scheme, we had deferred payments of VAT and income tax, and we had the business loans. So again, a lot of these schemes have started either winding down. So the furlough scheme ends this month. The small business grants, that's done as well. But what the winter economic plan did was give a bit more breathing space to those businesses. Basically, cash flow really helped, give a bit of cash flow breathing space. So for those people that did defer their VAT, so between March and June, that should have been due for payment in March next year. the Chancellor then announced that actually you can repay that in 11 equal instalments in 21-22 financial year. So again, spreading that tax hit that was potentially coming in March, and also the same for personal tax. So if you pay income tax in the payments on account system, you pay every January and July. The July payment that was due a few months ago got deferred to January. And what they're saying now is that January tax bill can be spread over the whole of 2021 over 12 monthly payments. So that big tax hit that people were going to have, or big cash hit really in January, is being kind of spread over the whole year. A number of businesses have been kind of propped up by the business loans. So we had the CBILS loans and the bounce back loans, and we know a huge number of people have applied for them, and also a number of people are still trying to get the loans as well. The deadline for the CBILS was originally the end of September. That's been extended to the end of November, and the bounce back loan deadline was originally the 4th of November. That's also been extended to the end of November. So that's given a bit more time for people to apply. And for those that already have applied, the original scheme was to run for 6 years. So the first year is no interest, no repayments, and then you'd repay it over 5 years. They've extended that another 4 years. So basically it's a 10-year loan now, which could effectively halve the payments, or nearly half the payments that are becoming due. So that was great. That's kind of helping the cash flow side of things for businesses. Obviously Torbay, South Devon, hospitality and tourism businesses have been enjoying a kind of reduced VAT rate. So that was originally announced for 6 months. That was due to end on the 12th of January, and that's now been extended to the end of March at 5%. So again, that's a great, again, that's going to help that sector. But well, I mean, I said, talking about what me and Helena have been talking about on our webinars that we do, and that's one of the things that I was quite critical about, the fact that the scheme was due to end in the middle of January, the middle of winter. It was crazy, and also middle of a month. So from a purely selfish point of view, doing the VAT returns, it would be nice if it was done at the end, a nice cut off. And to be honest, the end of March is kind of a nice cut off for us, being purely selfish, but also great for those businesses that are affected. The final thing I just want to cover was the help for the self-employed. This was one of the slightly later schemes that got announced after the furlough scheme. So we've had 2 tranches of self-employment grants. They've announced a 3rd grant that is more in line with the job support scheme, which Helena will be talking about in a second. But it's 20% of average monthly profits, whereas the previous 2 grants are going to were 80 and 70. So that's the 3rd grant that's going to be probably going live in November. There will be a 4th grant expected probably January, February time. We don't have any details of that yet. They haven't confirmed how much it's going to be, or more specifically, who the eligibility is going to be. We're aware of a huge number of kind of business owners, entrepreneurs, sole traders who haven't had any support at all, whether they were startup businesses or whether they basically just didn't qualify. So again, Martin Lewis has kind of given a little bit of hope in his show a couple of weeks ago that people who haven't been eligible for previous grants may just get something through this 4th grant that'll be early next year. And the final thing I want to say is that we've been doing this 3 days a week, well, 5 days a week originally, down to 3 days, and we've just been approached by Forgotten Ltd, who are very much a very active campaign on social media, who are really trying to drive, really get through to the government that there are these millions of people who have missed out on support. So we're going to be partnering with them. We're going to be doing some of these webinars directly to their members as well, which is quite exciting. That's enough for me. I'll hand over to Helena.
Great, thanks.
Thank you, James. So as I said, I'm Helena White. My company is the HR department, and we provide HR support to small and medium organisations across the Bay and South Hams. Now, I've only got a few minutes, so I'm just going to give you some nuggets of information about a few key things that are interesting at the moment. I will touch on the Kickstart scheme since you've asked me to. I'll also look at the job support scheme and talk a little bit about redundancy, because unfortunately that's going to be a factor of life over the next few months for many businesses, and also just touch on flexible working, which we're seeing a lot more of. So to kick off with the Kickstart scheme, not to be confused with the Kickstart grant, which is something completely different. The Kickstart scheme was something announced by the government that's going to provide 6-month job placements for young people, and the government will refund 25 hours per week of the minimum wage for those people. Any business in the UK can apply for this scheme if you're going to apply for less than 30 positions, so that's most small and medium organisations, you have to go through a representative to submit your application. It's a really simple application form. It's just a one-page, few very simple questions about the type of position you're going to provide and how you're going to support that young person. The young person needs to have been claiming universal credit, so they need to have been unemployed. You can't go out and find the young person. This is where it gets complicated. You have to submit your application. The government's going to take up to a month to process that application, and if it's approved, you'll be asked to provide some more information, such as a job description and some more details. And only then, if it's approved, then the government, the DWP, will contact the Jobs Centre, who will put the young people in touch with you. So that whole process is going to take weeks. So I have a lot of employers contacting us now to say, I found somebody who's unemployed, I want to claim the grant for them, they can start on Monday. That's not going to happen. You're going to have to go through the process and wait for the wheels of bureaucracy to grind very slowly before you get the people contacting you, and then you'll be able to apply for the grant. The grant, it's likely that the grant's going to be paid in stages during the 6-month work placement, and on top of being able to reclaim the wages, the national minimum wages for that young person for 25 hours per week for the whole 6-month period, you'll also be able to claim £1,500 per job placement for the setup costs, the support and the training. And once you've had a 6-month placement, you can then rotate another young person into the scheme, so you can use that slot for another person when the first person's completed their 6 months. So that's the Kickstart scheme. I might try and put some information into the comments later about how you can submit your application. Now, the next big thing that everybody's asking about at the moment is the job support scheme. This was announced by Rishi Sunak at the end of September, and it's a 6-month scheme that runs from the 1st of November through to the 1st of April to try and help employers retain employees rather than make them redundant. There's some fairly complex calculations about how much money the government's going to pay, how much the employer has to pay, and how much the employee will receive. But basically the bottom line is that if your employee works at least 33%, a third of their normal hours, then the employee will get 77% of their usual salary. The employer is going to pay at least 55% of the employee's usual salary, and the government will pay at the most 22% of that amount. Now, there's a useful calculator, I'll put the link into the comments box, that you might need to use for your business to figure out whether it's going to be worth it for your business or not. The majority of businesses I've spoken to have either said it's not going to work for them or it's a marginal call. However, I will caution before you dismiss it out of hand. Have a careful think, and remember that if you're weighing up employing somebody versus making them redundant, you haven't just got the monthly salary costs to think about. If you're going to make somebody redundant who's 55 years old with 20 years service and they're on a salary of £450 a week, that's going to cost you £17,550 in redundancy payment alone and notice pay. On top of that, you're going to have to pay for any accrued holiday they've got. So you might well be looking at north of £20,000. So you really do need to do your sums carefully before you decide whether the job support scheme's going to work for you or whether you're going to need to look at potential redundancies. So do look into the numbers carefully before you make a decision. I'm just going to touch on redundancies. It's a massive topic. I'm conscious we're running out of time, so just give me a couple of minutes on redundancies. Just a word of caution for businesses and organisations out there. Before you go straight to redundancy, just make sure you've carefully considered the alternatives. It might be possible, for example, to reach agreement with your staff to reduce their hours of work and their pay on a permanent basis, or at least until business picks up. You might be surprised what people will agree to if the alternative is redundancy and losing their job. So if there really is no alternative and you've looked at other ways to cut costs and avoid redundancy, then it's really important that you look carefully at the redundancy rules. They're very complex and there's lots of things to consider, especially if you're already claiming through the job support scheme, the job retention scheme, or if you're intending to use the job support scheme. the most important thing of any redundancy is to make sure that you end up with the best staff to take your business forward, and that you treat any departing staff fairly. So you've got lots to think about: notice periods, pay entitlements, selection criteria, and if you get it wrong, you could end up with an employment tribunal. So I'm not going to go into detail, but just to summarize, with redundancies, it's really important that you follow a fair process. At a minimum, it's going to take at least 2 to 3 weeks and 2 or 3 meetings with each employee, confirming things in writing to them and making sure that your selection process is really well documented. If you've got more than 20 jobs at risk, it's going to be even more complicated and even more time consuming. So in summary, it's not really something that you can plan via a Google search and just rock up to work the next day and announce the redundancies. It takes a lot more thought than that. So tread carefully, basically. Right, finally, just 30 seconds on flexible working. We've seen changes to business and working life in the UK that are going to be with us long after coronavirus is a dim and distant memory, hopefully. We've seen businesses catapulted into working remotely, and this has got huge implications for businesses. All those makeshift desks, kitchen tables, they're going to need an upgrade if people are going to be working from home more permanently. And as an employer, do you know the health and safety implications? Do you know about the allowance for £6 a week that you can pay to your employees? Do you know that you might need to update employment contracts to reflect that people are going to be working from home? And you might want to think about a home working policy to make it really clear what's expected of your employees. And are you protecting your assets and your data? So do your employees have adequate cyber security, for example, at home? And finally, do you know how to deal with flexible working requests? This could be an employee asking to work from home or to reduce their working days or hours, for example. And we're going to see an explosion in these type of requests. And it's actually a statutory requirement that any employee with 26 weeks or more service can make a flexible working request. And there's really clear procedures for an employer to follow when dealing with those requests. And if you don't, you could end up in an employment tribunal. So I shall take a breath now and hand back to Steve. Thank you very much, Steve.
That was a whistle-stop tour. And that's a snippet of, I know when I've tuned into your Facebook Live or your Zoom, folks, these two guys, they really do know their stuff, and there's lots of information out there. Plus, they're very, very willing and able to take questions. So tomorrow morning, 10:30, be there.
Yeah.
Yes, Uncharted Business, you're calling yourselves now, is that right?
Oh, it's streamed on a few different pages, and we stream it on the Accounting for Everything page, Uncharted Business page, and Torbay Hour page also gets, we stream it on there as well. So yeah, you hopefully can find us. If anybody's not on Facebook, we do it on Zoom as well. So we do have a number of people that join us directly on Zoom as well.
Excellent. Well, keep up the good work. Thank you so much for the support you're giving to our business community in Torbay and the South Hams. It's great to have you with us here today. So, well, we are pushing up against the clock as always, because we do like to cram so much into this hour and a bit. So I'm going to see, waiting in the dark somewhere, there's a bit of a mystery character. I think it could be Tony Medawar. Tony, are you there? Silence. This is a whodunit situation.
Can you hear me now?
We can hear you, but I can't see you. This is like a mystery.
I'm definitely here.
We can hear you, Tony. And
okay, well, I am sharing my webcam, so I don't quite understand what's happening there. Look, we've got very little time, so what I wanted to just say was, you know, Caroline earlier talked about the importance of, you know, planning for the future and recovery and so forth. This year has clearly been horribly, horribly difficult. The Agatha Christie Festival, I genuinely believe, is part of the solution and part of the recovery next year. We are planning on the basis of holding the festival the 11th to the 18th of September next autumn. And I know that some people will have had experience of working with the festival in the past, and I know that that hasn't always gone well. But I'm hoping that next year rather, we will do a better job our aim, and I should just say my own background is that I used to work for I was the Director of Strategy for the London Development Agency, which is the London equivalent of the Southwest RDA. And so I haven't been appointed because I'm an arts specialist. I've been appointed because I have experience of using an event like the Agatha Christie Festival to deliver wider benefits, and the wider benefits here are an increase in tourist numbers and through that inward investment in the area. So what I wanted to do today in the few minutes I've got is just really say to you, I can get a lot of people to come to this festival next year. We've got 4,000 followers on Twitter now. We're nearly 1,000 on YouTube, and that's on a channel that was only created just over a month ago. I can get a lot of people to come. What I can't do is get them to stay in the Bay for a whole week unless there are other things going on. And what we need are complementary events, complementary activities, and a particular problem last year was that the program for the festival wasn't issued till August. I'm not sure why that was, but it didn't come out till August, which for a festival starting in September is completely useless. So my aim is to get this program out by Easter at latest, ideally February. I want to offer all local tourist-friendly businesses the opportunity to advertise for free in that program, because I want the recipients worldwide to see that there's a lot to do. It's not just about going to a few talks and watching a few productions. That's part of it. That's what may hook them in. But what will get them to stay is there's lots of other things to do. And you will have my email address, and there's a briefing which I think Steve and Jim are going to send around, or maybe it already has gone around from Emily, I'm not sure. But I am absolutely up for talking to anybody about any kind of idea that you may have. If it's an idea that needs licensing by Agatha Christie Limited, then I will help with that. I can't guarantee we'll always get a license if it's needed, but I will help with it. And if it's just general ideas, or how could we be involved, what could we do? Just as an example, I was talking to a yacht repair company, and we were talking about the idea of having an escape room inside a yacht moored in the bay. So there are lots of possibilities, lots of ideas, and it's not that difficult to come up with them. So if you want to approach me, then do via the email.
Tony, can I just, nice to meet you, by the way. I spoke to you several times virtually, and so it's nice to meet you. And I think we've talked several times of how the Bay underplays Christie and the importance and the pull she still has, and how we could do so much more.
I think that's right, Jim. I mean, it doesn't matter whether you like Agatha Christie, you hate Agatha Christie, you don't like crime fiction, you resent the fact that Torbay has this albatross of Christie hanging around the neck. The fact is, she's an incredible draw. I was having lunch with somebody from HarperCollins yesterday, and sales of Agatha Christie books have gone through the roof during COVID. People like that kind of thing. And as I say, it doesn't matter whether you like it or not. If you want tourists to come to Torbay, you've got a Torbay tourist magnet in the form of Agatha Christie. And I think the more that we can do to get those people to come here, spend money, the better.
Well, yes, we've had the new versions of Death on the Nile, Murder on the Orient Express. It's all seemed to be hit the press and the TV screens this weekend. And if the Nationals are looking at building up towards the festival, I think where Agatha was ought to count.
Absolutely. One of my jobs is trying to get publicity internationally, so it's not something that you'll necessarily have seen, but I've been interviewed by American radio. I've had 2 articles in American newspapers, specialist tourist publications. And any time anybody wants a quote on anything to do with Agatha Christie, I raise my hand and say, yes, I can do it. And I always mention that the festival's happening in Torbay, in Devon, in England. So this is an opportunity. We just have to grab it. And anyone who was around, I should just say, Steve, anybody who was around in 1990 for the centenary celebrations in Torbay and can remember what that did in terms of tourist numbers to the area, that's the kind of thing I'm trying to get to. And the great thing about Christie is there's an anniversary for virtually every year from now till the next century.
Yes. Yeah. So it'll be 130 years. What is it? What is the 130 years mark?
It's 130 years since she was born this year, but it's also 100 years since her first book was published in America. Next year, it's 100 years since her first book was published in Britain. There's always an anniversary of some kind.
So basically what you're saying is Torbay business, do not miss a trick. This is an opportunity. If we want to build back better, we've got somebody here saying, look, you can advertise for free in the program. We just need to put on the events and the activities to make it so that we keep the people in the Bay that want to come and see it. So is that a good summation?
Yep, that's why we've extended it from 4 days to a week, so that it's clear that people are going to be here. There might be some good things happening at the beginning of the week and some good things happening at the end of the week, and hopefully there'll be other things that people do during the week.
Yeah, okay, well, thank you for the work that you're doing. And what I will do is I'll ask you to come back maybe in a couple of months. You can tell us a little bit about the progress and what else, if there's anything else that Jim and I can do to disseminate to our members, then please keep coming with the information.
I'll happily do that, Steve. I'd just say that we've already got one of the biggest names in crime fiction has already agreed to come next year. And one of the biggest names in what I would call romantic suspense fiction, but I suspect that the woman concerned would hate that title. So we've got some real names coming, and we're well supported. Okay, well let's promote it. Let's take this opportunity and help Torbay and have a bit of fun while we're doing it. So thank you very much for coming on today. I'm sorry we squeezed you in at the end. And talk about squeezing in at the end, Ali, are you still here with us? I'm not sure if Ali's still with us. She might. There she is. Yeah. Now, you kindly talk to us about the jailer bail. Just give us a couple of minutes about what is actually happening at the Rowcroft at this point in time, because it's so close to many of our hearts.
Okay, thanks, Steve. I'll try and be as quick as I can. The pandemic has obviously changed every aspect of what we do at Rowcroft, but now more than ever, we need to be there supporting patients and their families. It's changed loads of things clinically. So, for example, the use of PPE means that it's really difficult to show empathy when you can't smile or make facial expressions. It's really hard for people that are hard of hearing, which is a lot of our patients and their families who use lip reading quite a lot to understand what our nurses are saying. Often our nurses and our healthcare professionals will simply hold somebody's hand or give them a hug. Obviously, we can't do that at the moment. So it really changes the way we care for people, but we're still able to deliver that compassionate care. Because of social distancing and people's concerns, we've opted to do quite a lot of our consultations through the use of technology. So we sort of fast forwarded what we were planning to do anyway. And so we're still able to support people using technology. We've got added technology on our inpatient unit. And the other day I heard that there was a gentleman who is unfortunately in his last stages of life who really loved poetry. His wife was unable to join him on our IPU because of health conditions, but she was able to read poetry to him, and he was listening to that as he passed away. And things like that are just ways that we're using technology to make people's last moments the best they can be. We have been incredibly busy as a hospice. Our referral rates have really been higher than they've ever been before. So our community team who go out and about supporting people after they've had a terminal diagnosis, usually every month they get about 125-ish new referrals. In August, it was 175. Our hospice at home team, and those are people that support people in the last 2 weeks of life in their own homes. Normally they get about 38 new referrals a month, and last month it was 50. And our inpatient unit is at 96% capacity. So as you can see, we are absolutely snowed under in terms of workload. on the other side, in terms of funding, obviously we're really struggling at the moment. Our shops have been closed for quite a long time. We're now reopening some of them, but we've got to have significant changes across our retail outlets because of the pandemic. People might be back in the shops, but they're not necessarily going to charity shops. And we've noticed the shops that we've opened have had a 60% decrease in footfall. And then obviously our fundraising events have had to been cancelled this year. And what we're trying to do is work as flexibly as we possibly can in order to still reach out there, work with our community and raise money. So a lot of you might have taken part in our sleep walk in the past. That normally raises over £130,000. This year we had to do it virtually, and we were absolutely astounded by the community support in Torbay. We still raised just over £60,000, and that was with people doing our sleep walk virtually. We've got a new event running at the moment, which is our Sup Your Way event. So lots of people like me bought paddle boards over the summer, but it's challenging people to do a 5 or 10K or whatever distance they choose distance and getting sponsored for it. And we're working with local firm Red Paddle on that, which is really excellent. So if you do have a paddle board, please sign up, because it's a really great way to raise money for the charity. We were originally going to just do it this week, and then we looked at the weather forecast, and so we've actually extended it to the whole of October because we didn't want people falling off their paddleboards in the waves that are in the sea at the moment. We've also encouraged people to do virtual runs. So instead of doing the Torbay half marathon, we've said run your way, and people can do a half marathon at a time and a location that suits them, which means they can do it flatter or hillier than the normal route. And that's gone down really well. So we've just had to be really flexible about what we're doing, really. And normally we raise about £300,000 from people doing what we call community fundraising events. That's people putting on tea parties or raffles or coffee mornings. They tend to be the older generation that do that, and therefore they haven't done them this year, which is completely understandable. So that's a massive fall in income for us. However, we have seen people do things like marathons around their gardens. We've seen Neil Thomas, a lot of you might have followed him over the last few months. He walked from Big Ben to Torquay's Clock Tower. He was shortlisted for a Pride of Britain award. He's been all over radio and TV, and he's raised £28,000 for us. So we've got these amazing heroes from around our community that are really supporting us. We are absolutely astounded. Early on in the lockdown, we did put out an appeal, and again we were really astounded by the support we've had off the local community, and something that we've been changing in our fundraising team. Instead of writing thank you letters, we're trying to phone people as much as possible, and it's just been absolutely lovely because everyone we phone has said, do you know what, it's nothing like Rowcroft has made such a difference to our lives, and they've looked after whatever relative or friend, and they know what a great job we're doing. And I think it's just been really heartwarming for us to understand the effect that we have on people in our community. So from a fundraising perspective, it is really difficult at the moment. We're probably looking at a £1.1 million income drop this year, but we are really determined to do every single thing we can to continue providing the services that we can do. And that's what we're doing in the fundraising team, is using our resources in the best possible way. So, for example, we're not going to focus on trying to get community fundraising up and running. We're probably not going to put on our physical events, but we're using members of those teams and we're putting them into trust applications, working with high net worth individuals, etc., because those are areas that we feel that perhaps still have some money to give, rather than trying to persuade people who are perhaps worried about the economy, worried about their jobs, to raise money for us. So just because we're not asking you for money, it doesn't mean we don't want it, but we're just putting the focus elsewhere. We don't want people to feel guilted into raising money for us at the moment. So so it's sort of a really, really difficult time. Every day it costs just over £22,000 to run our service. So if anyone can support us, I know there are businesses that are doing really well at the moment, please do get in touch, because really Rowcroft is such an important part of our community, and thank you for all you've done for us.
Well, thank you. That is an amazing roundup, because these events are recorded. They'll be available on our YouTube channel via the website. So all of your words, we've still got 30 people on the line, which is great, and more people will watch it afterwards. But at the moment, I've just looked at Jim's jailer bail. He's got £640 and I got 555. And I think there's a few people been saying that I really should appear as the elf today, but it's not Christmas yet. But I did have a sneak preview at the Christmas box. Don't tell anybody, okay? Because It's coming, right? We will keep raising money. We will do our best to support you. Thank you so much for coming on today. And I like to think we saved the best till last. Alison, that's great.
Thanks.
And our big thanks again to our sponsors of the month, Torbay Weekly and Susan's Florists for this month. And of course, all our other sponsors will be featuring during the coming months. Great thanks to James and Helena, because James is a gold sponsor. Yes, James, I can see it there, accounting for everything. You've had your month. There's another one coming, so that's great. Lovely to see you, Helena. And I don't know if Tony's still there. Thank you so much for coming on. We will keep plugging the Agatha Christie Festival. We'll see Tony next time. We can get his camera working, that'll be good. Caroline Diamond has gone off to do some work to keep us all safe and healthy. I want a big thanks to Emily in the background. She's got to run off to a meeting in a minute, but she's been moderating for us today. So thank you so much. Thank you to Jim in the playroom, as always. We've been comparing pictures of rocking horses. We'll see if we can have a rocking horse race at some stage. But I'm going to bid you farewell. Torbay, it's great being here. Thank you for tuning in today. We look forward to seeing you next month when we will be talking about Kickstart. We will actually then have a feature on Torquay United and what it's like running a sports culture business in a pandemic with no crowds. How is that sustainable? Keep up the message of hands, face and space. I think I've probably forgotten somebody. If I have, I apologize. Let's close it down now and give a great jazz hands wave. Bye.
Yeah, bye. Bye-bye.
It's a wrap.